Are we photo? Okay, we are dispatched for a 64-year-old male patient who's complaining of shortness of breath. We're arrive on scene. I come in and introduce myself. Hi, I'm Matthew. I'm a paramedic.
Hello.
What's going on today?
I got some shortness of breath.
Oh, okay. My partner's just going to take your vital signs, if that's okay. When did this start? Do you mind if I take a seat, Jeff?
No.
When did this start?
Got really bad about a day ago.
Okay, so we can just as I'm going to verbalize a little over the center. So we can see he's alert, he's responding quickly, succinctly. He's sitting up, he's got pursed-lip breathing, and he seems short of breath with an elevated respiratory rate over a breath every 2 seconds. So he's over 30. It doesn't appear cyanotic as in here. And I'm just going to feel his pulse. Well, Jeff, do you mind if I just feel your pulse?
Go ahead.
So you've been feeling, haven't been feeling well over the last week. I'm going to add a few things in. I've been finding that you've been getting a little bit short of breath over the last week. So it got really bad tonight. It's 2 o'clock in the morning. You woke up with shortness of breath, and you've been having episodes of this nature throughout the last week. Okay. Does anything make it better or worse?
Leaning forward seems to help a little bit.
It's sitting up in general? Okay. Have you been sitting up on, Jeff goes on to tell me that he's been sitting up on more pillows and having trouble waking up short of breath at night. So relieved by sitting up. Have you ever had anything like this before?
Not really.
Not really. Okay. And do you feel, other than the shortness of breath, do you have any pain anywhere?
No, it's just
Just shortness of breath. And out of 10, if 10 was the worst shortness of breath you've ever had and 0 being none, what are you rating that right now?
Sitting up, it's
Let's call it an 8. Okay, so it's pretty bad, and you're breathing really fast. So you're breathing at about 60 times a minute. I'm kind of putting the scenario in your, giving you words as we would go. Typically, we'd let the patient answer the question. Don't worry about hyperventilating through this scenario. Severity 8 out of 10. Time started. You woke up 30 minutes ago, and it just hasn't calmed down since. And you've been having these waking up events just for the last week.
Yes.
Okay. Started about 30 minutes ago. 8 out of 10. No other symptoms, and you want to sit up. Partner's got SATs. Can you go ahead and get him on 4 liters of oxygen? Just titrate him up to 95, above 95%. You don't have any chronic lung disease, do you?
Not that I've ever been told.
Okay. Do you have any allergies?
Just soybeans.
Just put around his neck, it's fine.
Just
soybeans? Okay. Thanks for soy. Okay, so no. So are you on any medications? He says yes. He's on Ramipril. He takes nitro spray, ASA, Lipitor, and Synthroid. He's on the Ramipril. It's an ACE inhibitor. Presuming you have, do you have high blood pressure?
Yeah.
Yeah. Okay. I see a nitro spray. Do you have an angina or have you had heart attacks? He tells me he's had 2 heart attacks. I asked, when was the last heart attack? He says, had a heart attack 2 years ago. What did they do for you at that time? He says, I went away and got stents put in place. Okay. Yeah, if you don't mind giving all this stuff
It's
out.
pretty bad.
Pretty bad heart attack. It was your second one?
Yeah.
Okay. Since then, he's been able to be up and walking around, but has noticed that he's had gets winded easier since he's had his heart attack.
Absolutely.
Do you have any past medical conditions as far as neurological conditions? Never told any strokes or mini strokes?
No.
Seizures, migraines? Do you have any history of anxiety or depression?
No.
No? Okay, with your heart, do you have any other diagnosed conditions?
They told me that I have something wrong with my heart. I'm not sure what though.
Okay, I'm not sure what. Okay. No other medications or ongoing tests that you're...
Nothing. No.
You're seeing any specialists, just seeing your GP?
Yeah.
Okay. Have you ever been told your heart rate was going really fast or really slow? No. And you have history. How often do you have to use your nitro spray? Do you use it very often, or?
Not very often. Probably once or twice every month or so.
Okay, and is that pretty predictable if you're moving snow or something like
Yeah.
that? Do you find that you have to use it? And that hasn't increased in the last month?
Oh
No, okay. Ever been told you have heart murmurs or anything like that?
no.
No? Okay. As far as cardiac risk factors go, are you a smoker?
Yeah.
You are? Okay. Diabetic?
No.
Okay. You have a history of hypertension? Yeah, please.
Yeah.
And you're age greater than 55, you're male. Excessive stress lately?
No.
Okay.
Well, a little bit. The team's not doing too great, but
Okay, not just moderate?
yeah.
Okay. Are you a drinker?
No.
Okay, so you have some cardiac risk factor, and particularly given that he's had previous heart attacks, we know that he's at risk of having more. We'll go on to lungs. Ever been told you have chronic lung disease? I already asked you that.
No.
Emphysema, COPD, asthma, anything like that?
No.
Are you prone to pneumonias or bronchitis?
I had pneumonia once, but it's been probably 15 years now.
Okay. Haven't had any coughs or colds recently?
No.
Are you coughing and not coughing anything up or anything like that? No sputum production? Okay. And never been on home oxygen? No?
No.
Any other problems? Your bowel movements, appetite, any changes in those?
A little bit of acid reflux.
A little bit of acid reflux? Have you had problems with that today?
No more than usual.
But no chest pain today?
No.
Like, no. No chest pain, and you have acid reflux. What do you normally do for your acid reflux?
I just take a couple of Tums.
Okay. Normal bowel movements, normal urination?
Yep.
Yeah. And I've already asked you if you have any history of diabetes, or I can see here that you have hypothyroidism. Have you heard somebody tell you that because of the synthroid?
The doctor probably said something about it.
Events leading up to, so no other ongoing medical testing, and when did you last eat?
God, it would have been before bed. I had a little snack.
Okay, your partner got vital signs for me. So we got a
What's
heart
his,
rate of 93. Sats have come from 90 to 93, 94.
What's
93
his,
right now.
respiration rate?
So we'll bump over at 94. Respiratory rate 52. Okay. As I glance at that, I see he's still getting adequate chest rise and fall. He's been talking to me. He's been a little bit more easy in conversation than I would expect. So I'd expect 3 to 5 word sentences. I just want to keep an eye on that. Maybe we're at how many liters of oxygen right now? 2? If you want to go up to 4, I just want him up above 95%, if you don't mind. Well, that was easy. Blood pressure's quite hypertensive, 180 over 106. A blood glucose of 4.8, you say, and a temp of 37.8. I'm just going to give you a quick check over, do a bit of physical assessment, if that's okay with you, Jess. I'm just going to look at your eyes here for a second, if you don't mind. Just take your glasses off. Okay. So no anemia. I'm just going to shine a light in your eyes, if I can get my old phone to work. Just look right at my nose. Can you open your mouth and stick out your tongue for me? Okay. No centralized cyanosis. Close your mouth. No moist mucous membrane. I'm just gonna get you to lean back in your chair a little bit. I'm just gonna look at your neck veins really quickly. Can't do this perfectly, but I can observe and see. Let's say that we see his jugular veins right up to the corner of his jaw for this purpose today. So we see nice full neck veins. Just gonna push in here on your throat, trachea's midline. Can you take a nice deep breath for me? Okay, as I'm doing this palpation, I'm inspecting, seeing does he have accessory muscle use. He does have accessory muscle use and see quite severely short of breath. And no scars, rashes, or lesions noted on his chest. I'm going to just listen to your chest if that's okay. Just breathe in and out through your mouth if you don't mind. Nice big breaths. Be nice if I had a diaphragm on it, but anyhow. Deep breath. And out. Listening both inspiration and expiration. And I wouldn't be listening through his shirt. I'd be lifting up his shirt, untucking him, and then listening. I'd come up down through the top for the top, and then I'll come up underneath the bottom, just untuck his shirt and go to the other side. Comparing side to side, so here and here, here and here, here and here. I hear crackles on inspiration with a little bit of wheeze on expiration. I'm just going to listen to your back if that's okay, particularly in the bases. Deep breath in. And again. One more. One more. One more. And last one. Perfect. Just breathe easy. I'm just going to listen to your heart sounds if that'll be all right. So once again, I guess I can show you what I do. Can you just silence that QRS or turn the monitor off just so I don't... We'll show you how. And then I'd untuck and I'd listen. And listen. Okay? So let's, for the sake of argument, say that I have a third heart sound. I go lub-da-dub, lub-da-dub, lub-da-dub. Okay? And that's 3. And no incontinence. Do you have any pain in your abdomen at all? Doesn't hurt at all if I push in on your belly? No? No pain. Can I come down and just have a look at your legs for a second? So I see pedal edema, and I'll compare each side, see if I can push in, and we'll call that +2 pedal edema for the time being. Cap refill is 3 seconds bilateral. You can feel your legs fine. No pain in your legs at all. Wiggle your toes for me. Great. Just going to look at your arms, look at your hands. No evidence of club fingers. Cap refills equal symmetrical. And just going to feel pulses equal and regular. It's a little bit. Expect your heart rate to be a little faster. I probably should have set that a little faster. Okay, now to differential diagnosis, now that I've done my assessment, and we'll see if I forgot anything. So for my differential diagnosis, I'm thinking congestive heart failure is my front runner partner. The reasons I'm thinking of that is he's got crackles in the bases of his lungs. He's also got full jugular veins. And because it's full to the jaw, I don't need to do hepatojugular reflex to see if that's positive, but he's got JV, increased jugular venous pressure. And he's got crackles. His orthopnea also goes with that, his pedal edema, and he has a history of hypertension, and he's also had previous heart attacks that puts him more likely for heart failure. So what else could be causing this today? So big thing would be pneumonia, as far as crackles, and I don't think pneumonia, just checking back with you, you haven't had any cough recently?
No.
Haven't felt like you've had any colds or respiratory tract infections of any sort?
Nothing
And
like
haven't been running a fever?
No.
No. Okay, so it doesn't feel like pneumonia in that regard. He's denying chest pain, but because of his cardiac history, do you want to get a 12 lead right now? Because even though he's denying chest pain, and we can just, I'll click on that up here. We'll just say that the 12 lead's going up. We'll have a look and see if we see any evidence of ischemic changes on the 12 lead. Doesn't obviously rule it out. The other things that I've been thinking of, it doesn't seem, it's not obstructive lung disease as far as he's got a bit of wheezing. He's got no history of chronic lung disease. He doesn't have barrel chest. He's got no evidence of club fingers. He was a little bit cyanotic when we came in, but he's never been told. He doesn't take any puffers or anything like that, so that feels pretty remote. As far as pulmonary embolism, it doesn't report any pain, doesn't have any swelling, any legs. Have you been sitting still for any long durations or anything like that? Been up and around. Are you fairly active, or how much are you up and how much would you walk in a day? How many
just
minutes?
around the house a bit.
Just around the house?
Yeah.
Would you walk for any extended periods of time? Go for any 10-minute walks or anything like that?
Just
No.
like, from room to room or whatever.
Room to room. Okay, so fairly sedentary. So that's just another cardiac risk factor. Okay, as far as differential, I can't think of anything else that could be causing the symptoms right now, unless you think of anything. A treatment plan. I'm going to come back to PCP treatment plan for the time being. We're going to, because he's, so we'll just pull right back. So no chest discomfort whatsoever?
No.
No. And you take aspirin every day?
Yep.
2 any day, so he takes those already, so I don't think we need to give him any aspirin. As far as, I think we're going to put him on some CPAP. Have you ever been, heard anything talking about continuous positive airway pressure? It's going to be a mask that we're going to put over your face, but it's going to help. I think what's happening is you're having a bit of fluid get built up into your lungs,
Okay.
and that's going to help push it back into your vascular system where it belongs. Okay, it might feel a little bit panicky at first, but we'll go through over here. But I'm going to let you be fully in control, and I'm going to talk you through every step. Okay, so it has a big mask, but I'm gonna let you hold the mask so you can get comfortable. So partner, if you can, I think we're just going to start with 5 centimeters of water pressure, and as I turn and look at this tag, in order to accomplish, we'll say 4. It says right now is we're going to set it at 15 liters per minute to start off. Okay. That gives me 3 to 4 centimeters of water pressure. How I'll actually see the amount is I'll look at the gauge and see when he's exhaling, what it goes up to. And this is the real, this is the anticipated, okay? So this is reality, this is theoretical. So if you want to plug that on and just simulate, we'll put that on. And I'll just go over here and I'll pretend this is my patient here, because we're not going to stick this mask on Jeff's face. So I'm going to come in front of him, and I'm just going to say, okay, Jeff, you can come over here and talk for him. Jeff, I'm just going to get you to hold this mask. You want to hold this? You can hold it on yourself. I'm just going to take this and try to set it over your mouth and nose, okay? It's going to feel a little bit funny, a little bit like sticking your head out of a car window, but it's going to help, okay? So you just try holding that over just put that over your mouth and nose, and we're going to try make a seal, okay? And if he coughs or if he sputters and is not liking it, we'll just say, okay, we'll just come off for a second. He may or may not still have the nasal cannula that we had on him before. We can leave that be for the time being. We'll take it off when we go to strap him on. So we just get it to a point and just talk, okay? Just try taking some nice deep breath. Might be a little bit uncomfortable at first, and we'll watch and see that he we're getting a good seal. As he becomes more comfortable, can you let me just hold that there for you? So I'll just hold that mask for him. And partner, do you want to grab those head straps? So once we have him settled down, this might be that I'm holding this mask here for 2 minutes, right? Till he looks more at ease and more comfortable. We're looking for SATs coming up, blood pressure, all those things, improving for ourselves, making sure that we're not becoming grossly hypotensive. And then once we have a patient settled down, then we'll strap this on. As far as strapping it on, we'll just get our patient lean ahead. We're just going to put these straps on to hold this mask on for you, okay? So we'll just get you to lean ahead, that spider web just goes behind his head. Okay. I find if I strap the bottom ones first, it works better. So we're just going to snap up. We'll come up at the same time. I find it pulls the hair less, and we'll just strap on right on this one right here, if you don't mind. Come on that one right there in the bottom, We'll just spin that around. Sorry if we're finicking around, and you can see why you wouldn't want to do this right until the patient was settled down. That's fine. Let's just see what that looks like. Okay, and then we're going to put these ones over here. These are a little bit in front of your eyes, a little bit. You let us know if it gets too tight on your nose, okay? So you want to tighten I find that if you tighten the mouth ones more than the nose, this wants to tend to ride up into their nose. So I tend to not have these just tight enough to make a seal. And you can see how the top ones are quite invasive into the line of sight. So we want to get somebody calmed down before we strap this onto them, if that makes sense. And then we'll just let him breathe through that. You can see even now my tendency is for this to roll up on his, up into the bridge of his nose. Some will have a little thing that comes out on their forehead and holds the mask on their forehead so it doesn't rock too much into their nose. You'll see that in the hospitals. Okay, So we're just going to let him breathe out through that. So while we're monitoring him as I'm taking him off to the hospital, I'm going to be reassessing vital signs. I'm very interested in reassessing lung sounds and reassessing blood pressure, because it's possible that as we increase his thoracic pressure, he could drop his blood pressure. We'll see. Most of the time this works really well. And he's got a generous blood pressure right now. So we'll just watch him as he goes. Okay? How long was that?